Welcome everybody to the Performance Health webinar for today. So we are going to talk to you about how you might want to fit a whole variety of off-the-shelf splints for positioning. But the first thing is to introduce my lovely guest with me today. So this is Miriam May. She is a neuro-rehab specialist OT, and actually we met professionally over a splint. So, in fact, it's a very core to our relationship with having that sort of pulling together of a hand therapist's knowledge of splinting and a neuro-rehab OT's knowledge of everything else that's important. So that's really where our relationship started off, and we do still share patients. So I'm Nicola Goldsmith, and I'm a hand therapist and the clinical ambassador for Performance Health. So we're going to today have a little presentation, and then we're going to run through as many of the off-the-shelf splints as we can. We've got a really wide array of them. It's going to be a whistle-stop tour for you of the pros and cons of different ones, and a little bit of the theory as to why you might want to choose one over the other, because it's hard for you to get your hands on all of these different bits of kit. By all means, please, if you've got questions, just pop them into the chat, and we'll try and make sure that at the end we've got time to run through some questions. So without further ado, let's just go on to a bit of a presentation. So we're going to today try and cover that whole debate about should you, shouldn't you, splinting in neurology. And we're not going to come up with an answer, which won't surprise you, but just a few of the concepts behind it. And then desirable features of positioning splints. What might you be looking for? And then we're going to have a look at the ones that are available that are off the shelf. You've got the thermoplastic pre-cuts, if you're not a regular thermoplastic splint maker. Then we've got our palm protectors, and then some more functional splints, and hopefully time to have a little look at a functional glove. So just a few key facts looked up in the UK. Now, I know our audience isn't all UK, but we are very UK based. So there are approximately 8 million people in the UK with some form of a neurological condition, which is actually huge. 80% of those are strokes or acquired brain injury or multiple sclerosis. And so we really wanted to have a look at, where does splinting fit in with this cohort of our population? And we know that as clinicians, we really need to rely on evidence-based guidelines and clinical reasoning for each individual patient.
So the first place we felt to start was really to have a look at the new NICE guidelines set out at the end of last year. I think one of the most important things that it says is that not to use routinely hand-on-wrist splints. So it has to be looked into clinical reasoning and assessment first. But what are we considering? What things can we consider after a stroke? So we're looking at maintaining joint range, soft tissue length and alignment, increasing soft tissue length and passive range of movement, the combination, which is really important. We're looking to facilitate function. What are we looking to achieve with the splinting, as well as looking at hygiene, comfort, and care for the arm. The wrist and the hand splints, it's really important they're fitted by somebody that's trained, and that the individual, as well as the carers, are instructed, shown how to use, when to use, and how to put them on comfortably. So we also had a look at what the Royal College of OT Specialist Section looked at and ACPIN looked at. So in 2015, they looked at the various aspects of splinting and should it be looked at and should it be used routinely. The bottom line is that there is no exact definition of what is and what isn't useful, but it's saying that it is beneficial. So we're looking at reducing spasticity, and we're looking at prevention of hand pain and loss of range of movement.
So then we thought, well, as well as the guidelines, we should have a look and see what's there in the literature in terms of some meta-analysis or any trials that have looked at a variety of splints for the neurology environment. So then we found a paper. There was a systematic review. They looked at 11 articles meeting their inclusion criteria from the American Journal of OT. And their conclusion really was that there is a moderate strength of evidence that splinting, that is static splinting, dynamic splinting, and manual stretching, is able to increase hand function and also improve functional tasks. But again, there's a low level of evidence for stretching devices in both increasing hand function and improving functional tasks. And this was looking obviously over 11 different articles and pulling all of that knowledge together. So a much smaller study, but really looking at sort of efficacy of splinting is a study we found in a Physiotherapy Journal, again, very recent, 2022. And they were looking at reflex inhibitory splinting and to look at whether this actually was a reasonable thing to do. Now, like with all of these smaller studies, the numbers obviously in the two cohorts were relatively small. You had 16 people in the splinting group and 13 in the non-splinting control group. And what they were looking at is whether there was an effect on tone and whether there was an effect on the ability to get active wrist extension. And actually what they found was that in the treatment group, so those that were wearing splints, they did have decreased tone and increased active range of extension angle. Now, obviously, every individual patient is going to be different.
So what are we looking for with positioning splinting? We are assessing the hand, we're assessing the arm first. We're looking at tone to start with. We're looking at hygiene. We're looking at preventing contractures, shortening of muscles. And looking at preventing contracture management, because what we have found is that the management of one contracture is about £10,000. So therefore, managing it from the beginning is really, really important. So, but also there is a use of splinting post-Botox, because once the Botox is done, many patients think, well, that's it. But no, we have to maximize the effect of the Botox, and that's through stretching and positioning. And obviously what we're looking at is we're looking at maintenance of range of movement, which is so important.
So what's important to me as a hand therapist, and when I get a patient, or I'm asked by Miriam to see a patient, then I'll be looking at what has been her clinical reasoning. Why do you think with this patient that you might want to use a splint as opposed to not? So if you talk me through some of the decisions that you're thinking about.
So ultimately, when we're looking at the hand, we're thinking of what are we trying to achieve here? Are we trying to achieve maintaining position, hygiene, so that the fingers aren't in the hand? Are we thinking, but we've got to think about wearing routines. We've got to think about whether the client is comfortable in it, because if someone's not comfortable in it, they're not going to wear it. We're looking at, trying to maintain range of movement? If there's increased tone, that we're teaching them passive range of movement, stretching, and then to keep the hand in a nice position once we've done some work with that hand. And also for function. Function is really, really important. So ultimately, what movements are we trying to achieve? What are we trying to maintain in order to achieve function?
Such an OT.
Yeah, well, sorry. It comes now.
So obviously there's no single answer, but one of the things I found interesting, and this is maybe where things are different in neuro to my environment, plastics and orthopedics and rheumatology. If I was wanting to elongate tissues, I was working on a contracture, for example, I would be having a splint in situ for at least sort of 6 hours, if not 11, just from our literature. But when we looked at the literature around splinting for neuro, the time is so wide, so varied.
Yeah, and I think that's when we looked at the different case studies, and going back to that Akpin and Arcot article, is that one of the things that they stated was the wearing regime was so huge, anything from 1 hour, which I'm not sure why it would be 1 hour, from 6 hours to 12 hours to 24 hours. And it's so wide, and clinicians are making those judgments individually, which is the case, should be the case with a neuro patient. But there is no set regimes, and I think people do struggle with that.
Yeah, well, I would struggle with it because it's hard to know what to instruct a family.
Yeah.
If we can't say, look, we know you need at least, whereas in my field, we do know that.
Yeah.
So that is definitely future research that's needed, isn't it?
Yeah, definitely. But I think that with neuro, it has to be case by case.
So we're going to have a look at some of these positional splits. And what are the key features that you thought we ought to have a think of?
So we've obviously got a huge array of different types of splints here, but we tried to get a little bit of a guide for you to look at how adjustable it was, what sizes they came in, whether they're different sizes or one size fits all. Cleaning, so removable lining, whether it was washing, whether it came with a spare, or what the washing instructions were, and how easy or how adaptable it was to the individual client that's sitting in front of you. So we're going to literally go splint by splint and put them on and give you a little bit of instruction so that you can see how they look.
And one of the things for me is always about the strap placement, because of course a splint can be brilliant, but unless the straps are in the right place doing the right thing, actually doesn't really work, does it?
Yeah, and also it's about you being sure, making clear on your instructions and giving written instructions, because it's not just whether we can put the splint on, the carers, the relative, or even the individual has to be able to put the splint on themselves. So if it's really, really difficult to shove the hand in and pull the straps on, it's not going to be worn.
And then finally at the end, we'll have a quick look at functional splinting, just how to position the wrist to enhance, function, and also just have a look at a functional glove.
Yeah.
Okay, so should we start having a look?
Okay, let's start having a play, shall we?
Yeah.
Okay, so we're going to start with number 1, which is the Roan Economic preformed functional resting splint. So,
Okay, so this is the right hand, this one.
Okay.
So this is the only one that we found that's actually got latex in it.
Yeah.
So just to be aware that obviously, any latex allergies of the carers or of the patient themselves. Now, it actually we've adapted this, haven't we, to make it fit?
Yeah. So it came flat, and then we've bent it, and it's quite nice. It's got wires in it, so it's quite easy to move. We've got the guide here, so we've got that coming in here, and then strap wise, got one coming over the MCPs. I'm going myself. One around the wrist.
So the straps are actually attached, and they're very comfy. I do like the material. It looks really clunky, but actually when it's on, it's very comfortable.
It's quite light.
It's very light.
Yeah.
It weighs nothing.
Yeah. So the only thing I suppose we'd be aware of is that we've got no thumb strap, and obviously we're pulling right into abduction here, but we have got the guide underneath here so that it does support the position. Goes across either the MCPs or the likely drops there, up and down.
Now, one of the things I liked about this one was that actually there's very little material here, and it left a lot of my palm free. And yes, it was rigid. You didn't like that, did you?
No.
But it's very, very comfy, and it's nice not having any material here for me. But the downside for me was that this is very shallow.
Well, actually, I don't have an issue. I find that that's actually quite nice. For me, it really was about the wrist support, that I didn't really felt that it's just quite thin here and didn't provide enough wrist support. But
they do say with this one that it's aimed for people with mild to moderate tone. It's not meant to be for someone with a very high tone. I would agree, because the wrist was just about
it's movable. It is easy to bend and stretch, which means it's easy to bend and stretch if you've got a high tone. So no, if you've got a high tone, that's not going to be as good. But
it is super comfy.
I like the feel of it.
Yeah. Okay. So while I take this off, do you want to grab the next one?
Okay, so next we have the QuickBom progressive hand splint. So I'm going to just undo the strap.
So this one took us a bit of quite a few of these took a bit of thinking about. Now this actually comes with 3 different size what would you call them? Rolls. We actually wrote small, medium, and large on them once we opened the packet, so we could figure it out. And we've actually put the small ones
so
onto
they
the Splint.
literally slide out and slide in, depending on the finger position and how tight the toe is. The other thing that we quite liked on this one is that it's got fully removable straps. So you can actually decide where you want the straps to go, where you feel that the patient needs more support. So really, it just comes like this. And again, we bend it round to get our shape. There. And then
Now, do you know, one of the things we found is we really have to push this right down.
Otherwise,
Because of the way where the wrist bit is, otherwise my little finger falls off the end.
Yeah. Okay, so having taken them all off, I've now got to remember where they all go.
Well, it doesn't matter, you can put them where you want to for each individual, can't you? So again, you can put one round the fingers.
Actually, this one is independent of the positive. This one has got a double strap there, so that I can come round.
Again, the material of the strap is
Yeah.
really soft. So even if I'm pulling against it, it's not going to rub me, which is quite nice.
Yeah, they are. Their straps are really nice on this.
Yeah, they are. And really, you can adapt that however you want.
Yeah, and you really can. You know, it doesn't have an individual thumb strap, so really you can choose to incorporate the thumb in the strap so that it's covering everything.
Again, it's very, very light.
Yeah.
Very light indeed.
Yeah.
This one covers, of course, more of the forearm. But yeah, that one works quite nice, and at least you've got these. It comes in 2 different sizes: small, medium, and medium large, like the last one does.
Yes.
And it suggests that you measure the wrist circumference in order to work out whether you're small, medium, or medium large. Okay.
Yeah.
Perfect. Right, there we go. Number two done.
It is quite nice soft. You just need, it is that position, because otherwise you don't want to get some deviation at the wrist. So just need to be careful with positioning.
Brilliant.
There we go. Okay, so the next one's a little bit more adaptable and a little bit more constrained. So this one is the progressive palm protector splint. Okay, and it's one size. And then Nicola said, "You're going to say that you love this because it's got this that you can't. It's easier to put in."
Yeah, knee rings will always, for a weak hand, are always easier. But this, of course, is one size, and it's enormous.
Yes.
I have quite little hands. But you can cut it. So can you see there's an overlap here? So what I would do, would you like to get a pen out of that? So we can adapt this so easily. Is just if I draw on here like this, and then the same on this with the overlap, I just draw on here. Okay, and then if we pop it off, and then I can just take my normal scissors and I can cut this splint to size. And it's easy. I've got an arthritic thumb. I'm not super strong, but it's not giving me any problems with cutting. And I can do the same on this bit here. So I can take this away. And that immediately is going to debulk it. So if I put my hand back in again now, I may not have taken quite enough off there. No, that's all right. There we go. So then the ends meet. So you can just play with that to make them happen. Obviously, there's nothing there for my thumb, but it does have one that has a thumb version with it.
Yes, so I'm going to also show you, so that's the forearms. Okay. So what we've also got in addition here is we've got this little puffy thing here, which is actually for our thumb. So that we've got a little bit of thumb support just for positioning. And then we've also got our finger separators, which will go down to here, go around here.
Yep.
Pull those down, and then just apply that strap.
Such a perfectionist, sorry. There we go. Now, you can see the whole thing is just flopping around, and I'm holding these in my hand here. There is a webbed piece on the front. And now what I can do, you can either have one or you can have two of these pieces of easy form that are provided with it that will work to go into this slot. So if I just take this off and pop these into the splint pan,
I'm going to slide my hand into it so that you can adjust that into me.
I'm going to do it actually off you.
Okay.
So I'm just going to heat those up. Oh, machine that it's at. It's easy form. Okay, tell me when it's ready. Okay, so you've got this webbing, and you just have to pull these bits of thermoplastic out from under here. But depending on the angle you want on the wrist, which angles? So, okay, I'm just going to heat them here onto the wrist.
So we've got a nice, comfortable wrist down.
Okay. Now, if I imagine that Miriam's got really high tone, I'm going to actually attach the two to each other so that it's really thick. And I'm literally just going to place this along her hand. So it's in the right position and the right angle that I want. And then once that's gone off, I can literally slide those inside and they will now give some support onto the splint and stop that from.
Yeah, so it's really supporting that wrist down.
Now make sure you don't come higher than the MCP so that as the fingers sit relaxed into it, then it doesn't sort of dig in. It's quite warm in here today, so it's a little bit tough. Should have left the door open. And random people will start walking in and we'll be in trouble. Okay, I'm going to leave you with that on
Yeah,
for just a second. Yeah, exactly. Okay, so you can just see that here we've got this sort of foam and then looks like a, what do you call a fleecy, but
Yeah.
quite a thick sheepskin cover on the top.
Yeah.
Cleaning.
Yeah. It is just obviously you can't put it in the machine. It literally is warm water and a sponge.
Okay, hand wash it.
Yeah, hand wash it, and it's one size. And so, as we said, you just trim it down to what you want it to be.
Perfect. So that will go off in a minute, and that will just come in here, and we'll just slot it in, and it will control this part of
So
the
what
wrist.
you've got is, and we'll slide it in very quickly, is
This will
so
sit.
it's just going to sit in there and just hold the wrist in your muscle.
Okay,
Okay.
cool. Right, we'll leave those
Move
there.
on.
Yep.
Okay, so we're going to move on to the comfy splint, which is very comfy. It's really nicely padded, very
Whole range, isn't
Yeah.
it? So
Yeah.
we've actually got three different ones
Yeah.
to look at. One of the things that I liked is that they come in this very fancy this very fancy bag.
I know you like the laundry bag, don't you?
Yes, it's a laundry bag, so you can actually put the cover into it, which unzips, and you can so it has a zip underneath.
And take them out, put them in the laundry bag and put them in the machine. So these are obviously for higher tone because they're really have to use quite a bit of strength to bend them into your shape. So this one is the okay, so this has got no latex in it at all. So we've got our guides here. Now, the only issue with the guides is that it means that it can't get right over your MCPs and your IP joints because we've got that ledge there. But it does help with the positioning. Thumb is free.
Thumb is free. So this one is the wrist hand one.
Yeah.
Whereas we've got one as well. That's the hand thumb one that does position the thumbs as well. They say that this material has an antimicrobial barrier to stop skin breakdown. So hopefully that helps with the very dependent limb.
Yeah. So we've got really 4 straps all up. So we really have got every aspect and every joint covered here. And it's just a really nice, comfortable position. Of course, we can change the angle. I'm not going to do it on Nicola because it involves quite a bit of strength to get the angling of the fingers. So you do need to take some time to really get that position right for your patient.
We found it easier to push it against the table, didn't we, rather than
use brute strength.
Yeah.
And then the thumb, literally, it just sits there. So it doesn't have support, but also it's not being pulled into anything. There's none. It's quite nice and free. It's a really nice soft material.
Well, they're called comfy splints, and actually they are comfy, but they're also quite bulky.
Yeah.
But I think they would be quite airy, in that I don't know on a very hot day, but it feels like it would absorb any of the sweat, and they're so easily washed.
Yes.
That's
quite nicely padded. So as well as the material, you've got quite a lot of padding going on. So there's nothing really that's going to dig in to any of your patients as well. So that's really something that you need to be aware of. If the tone is tight, that you're not going to have any edging or any marking. So it is really nice in that way.
Yeah. So if I pulled up in high tone, or it was rubbing on my leg, or that,
you've not got any sharp edges.
It would be fine.
Okay.
And as you can see, we've got 2 others in this range as well.
So also in the comfy range,
and all of them come small, medium, and large. And they
with your little bag.
Yeah, with your little bag.
Okay.
So this is the wrist thumb one. Yep. And that's so. Do you want to put that one on? And I'll put this one on. And yours is the rest. The comfy rest.
So this is the comfy rest splint, and I would say that this is probably the splint used most in the community. So I'm just going to...
You mean this is the one that you use?
Yeah.
Okay.
Yeah.
Stop attacking yourself to me.
Okay, so now the one thing that I know that you didn't like with this shirt, Nicola, and I do, so I'm going on, and I do tend to agree, is that the forearm is really very shallow.
Very, very shallow, which means that there's much more force needed through the strap than if it was a little bit rounder. Certainly when I'm making a splint, I would always want to come to 50% of the circumference of the forearm. But one of the things we did like were these straps. So these are attached here, and you can see on this one, I can actually get that really lovely oblique strap along with a strap across the IP joints. And there's another one for the thumb. So, and they're actually in the right place, which is really nice.
It comes from the center and it's coming across the thumb. And again, we can change the angle of the thumb to bring it into more abduction or into straighter if you like. But again, we've got our finger separators as well.
The finger separators separate though, isn't it? So you can add it or take it away.
It's Velcro.
Yes, Velcro top. So you can take that away.
Okay, so that's that one.
So that one's the rest hand splint, and this. So the other one before was the hand wrist one, and this is the wrist thumb one. Just to so you can differentiate between them. Okay.
Help you.
So again, we've got the same. We don't need to do it because it's the same thing with the straps.
Yeah.
It's very highly.
So we've got our guides here, but they're a little bit lower down so that you can actually get a little bit more comfortable across the IP joints here. Again, there's
now we support the thumb.
We've got the other thing that we did before was we played around, not with that strap, with the top two. Can you leave that on? Yeah. And we just changed the we went across to give more support if you're worried about those things popping out. Okay, perfect.
Get yourself out of this. And then we've got 3 splints. I don't know if you want to bring them all. They're not all what I would call preformed. So we've got a preformed, just what I would call a normal resting splint here. This one is made from polyform. Now, polyform is one of, I don't know if you've watched any of the previous webinars that I've done, but I talked through all of the material. Polyform is very moldable. So if you're doing a neuro splint on your own, doing it in polyform is quite hard. It does also come in easy form, and that's what I would recommend, particularly if you're not a regular splinter or you're doing it on your own, because this is just going to completely flop away from you and lose the shape and lose its shape very easily. So if I were to do this on Miriam, again, you can see it does come small, medium and large. This is a medium, even that is huge. I would want to heat it and cut it, both the fingers here, and remold it. Then you've got this one here, which is, it has a ball-like in the palm. So this one is called the resting pan mitt splint, and it opens out that palm into this sort of position by putting a more of a ball shape in the palm here.
Easier with the thumb as well, so we've got less abduction in the palm, so it's more.
And again, this is easy form, so it is going to be easier to manage.
Yeah.
If you wanted more abduction, you could by just doing a pre-stretching here, and that thumb piece will just rotate really naturally around. We'll see if we've got time to actually make any of these, but you pop that one down. And then this one, which is the anti-spasticity ball splint, which comes with the webbing ready on the fingers. Now, I've never used a prefab one. I've always made these myself. And again, if I was making it myself, I would make it from polyform or polyflex. This one is preformed. Again, if you're on your own and you're doing this, this is polyform. It's tricky. And you might want to just heat the proximal end on its own, get that right, and then heat the distal end, so that you're not got too much material to manage at the same time.
If you make it too wet, it's just going to go flat.
Yeah, it's just going to go. They're all supplied with their strapping, which is really nice, and it gives you plenty. You've got plenty of straps. The straps that come on this one we liked. They had this extra padding that goes across. And there was one other thing we really liked with this, wasn't there?
Yeah.
And that is, I don't know if you can turn around. Sorry.
That's all right.
Right. I'll get rid of that. So that comes with this quite hard piece, but it's lined with foam that sits over the carpus. So that really holds the wrist in place super well. So we quite liked that in terms of it did give stability and it's soft.
Yeah. Yes, it doesn't feel like a hard splinting material at the top of your wrist.
Yeah, absolutely.
Okay.
All right. So let's pop those. Pop them. This one I'll keep because this one we might demo, Miriam.
So I'm going to move on to our palm protectors, which is obviously a very, very useful piece of kit for hand hygiene. And when you've got somebody that's got really, really high tone and you're really worried about those fingernails into the palm, because as we know, there is nothing worse than fingernails in the palm. And also for the once it's been washed and cleaned, so that we can keep it so it doesn't have that smell. Okay, so we've got the two. We've got the one which is really simple, very tight, nice and simple. Obviously, the problem that it's one size for both of these. The one problem that we have is obviously is about hygiene. They don't go in the washing machine. It is just about sponge washing them. But
they say in the instructions you can hand wash them.
Okay.
Fully hand wash them.
Yeah,
you can get them totally wet and totally
fine.
But then they have to dry, so you're probably going to need two.
Yes, yes. And then this one is obviously it's got finger separators in, and so obviously don't have such flexion there. It's quite comfortable.
Yeah, I mean they're very simple, aren't they?
Okay. So then we move on to the palm shields. Again, I've got two here, one for you, one for me.
Thank you very much. Better give me the simple one. I can work out what to do with it.
Okay, so it's a little bit like the palm protectors. We slide the thumb in. We've got finger separators. Got finger separators. Okay, and then it's a little pad here just to protect the thumb, so that we've not got any rubbing going on there. And then it simply just goes around here.
obviously you would cut this to 50 size and shape. So it sits in like this.
Yeah.
So yours is the padded one,
Yeah, so
which means, because mine is just foam, so it really does bounce around. It's not going to hold a position at all. It's purely for hygiene.
Yeah.
Your one has got a little bit more padding, so if the fingers are rubbing next to each other, more,
it's gel
inside,
yeah,
hasn't it?
yeah.
A little bit, and a little bit of gel where I've got nothing in the front
Yeah.
here.
So it's just really comfortable in between the fingers. But we're not talking about this, it isn't positioning. These are just a bit like the other palm protectors, which are more traditional ones, which I'm sure people are more familiar with. It's just really for hand hygiene.
Yeah. Okay, yeah, lovely. And then we've got one more that neither of us had actually ever seen before.
No.
Which we actually quite liked.
Yeah, I do quite like this. Now, obviously, it doesn't involve the forearm or the wrist. This is literally just for the fingers.
Let me just put this in.
No, that's right. So we are literally putting it onto the hand like this. Sorry, like this. So it's got shaped. So we've got a little bit of an arch there to place our thumb and our fingers round. I'm going to ask you to do the up.
We did it in a cross, didn't we?
Yeah.
Like this. Yeah. There we go.
So it's a really nice position for the fingers. It's got foam, cut foam on the inside. I think it comes in different sizes. It's small, medium, large, and extra large. And it's just a really comfortable position for the fingers.
What we really liked was if you've got a dependent hand, it's got these, it's very clever where it's got the flat bit. So you can have a flat bit here to stabilise or here to stabilise.
And the important thing is that when I'm stabilising here and here, my thumb is actually completely clear. So that if you've got an arm that's internally rotated and it's sitting in pronation like this, that you're not going to have the thumb rubbing or the thumb pushing. And if you've got decreased sensation, you're at risk of damage. So it's for nice little ledges that you can just in different positions.
Yeah, we liked it.
Thought it was simple but effective.
Yeah, very well. Somebody's really thought that through.
Yeah.
Not being designed by no team.
Oh, definitely. Okay.
Okay, so I've just put one of those 3 splints into the splint pan. So if you want to just actually then swap over.
Yep. Left arm. Which one did you choose to go for?
Just put the most simple one in first, because that's probably what more people would use.
What material is that? Is that the
Well,
easy form?
what?
Is that the point form?
It is, I thought it was an easy form one, but it's not. Now I can feel it in the splint pan, that definitely is a polyform. So it's very moldable. Now, if you're managing a really moldable material on your own, just work with gravity if you can. Obviously, with high tone, it can be difficult, but get gravity to work with you so that you've got some drape so that your hand don't have to be everywhere. So let me just, it was too long on the thumb and too long on the fingers, so I'm going to deal with that first. And when you get a splint that is this big in such a moldable material in and out of the splint pan, make sure you support it all the way along its length, because otherwise you're going to find that it's going to be even longer than you wanted it to be.
Stretch.
Yes, it will stretch. So I'm just going to cut some length away. And you can see how easy it is to cut it now that it's heated. Never ever cut it while it's never cut it when it's cold. So I would always support the whole length because you don't lift it like this ever. And always start your splint with the thumb. So if you can get the thumb in the right position, then everything else, nothing more annoying than a helpful patient. Something helpful. Now, the nice thing with Polyflex is it actually does all the work for you, or Polyform, in that I don't have to do very much.
in order for it to really follow your contour. So people will go wrong by over handling. Just let it be.
So has it held much of its original shape?
Completely.
Okay.
Yes, it has.
Yeah.
And I'm going to then think about, now, when is Miriam going to be wearing this? Is she going to be wearing it in the daytime? Is she going to be wearing it at night? Where do I want the forearm to be in terms of its sort of pronated, supinated, mid position? Now, if you stop by splinting in supination, as you bring it into that mid prosupination position, just adjust how that'll stretch it. So just adjust where your forearm is so that you've got the forearm sitting in as if it's a really nice supporting, coming equally up from the two lateral borders, but it's really holding its position very, very well, isn't it?
Yeah.
It's a very comfy material against the skin.
No, it
It's
is.
very smooth.
Yeah.
But did you notice it picks up every single print?
Yeah.
If I score it by mistake with the scissors, if you have a little bit of something sharp in the splint pan, anything like that, it's going to pick it up.
Yeah.
But that has actually kept its position really well. And then I would strap it across. Of course, we've got the lovely pre-made straps, which are nice.
The only thing that we don't have with these straps is a thumb.
Is a
strap.
fun one. So I could literally just, for the any strap that's going to be circumferential around in a transverse plane, then you have the thicker one.
Yeah.
Then these work really well. They're lovely. I mean, how easy is that? They're sitting there ready.
They're very
They're
nice.
very soft.
Yeah, they are soft.
So this, super easy. There's that in place. There's that in place. However, this is where this doesn't work. If you're going to have a strap over the fingers, it needs to be oblique.
Yeah.
Because we want to, so if I go straight, if I go transverse, that little finger, particularly if it's got tone, is just going to pop out. Now, if I were to use this strap, then you'll see that actually where I want to, can I tip you this way? Because it's white, it's not very easy for you to see. But here is where the hook Velcro is. But actually, I want my receiving Velcro down here. So I would need to put another piece of Velcro, hook Velcro here, and then cover that bit up. Or just keep these straps for your transverse transverse needs for other splints and make your own. And the same with the thumbs. It doesn't come with a thumb splint. A strap.
Yeah.
But that works quite nicely.
No. And I like the straps. Because some of the splint straps can be quite sharp. And this is quite
they're soft.
Yeah.
They are nice and soft. Right, so I'm going to bring you this toy here.
Okay. Do you want to have a look at the wrist ones first?
Oh, yes.
Okay, so we're talking functional splints now. So those are more positioning and management of contractures and position of tone. So now we're really looking at function. So we've got very simple, I'll take one, you take the other, future splints. And that's really to support the wrist.
So bar along the front, literally giving some tone support. The only difference between these two, other than the fact that one is black and one is brown, but they both come in both, is just the style of strapping. So anyone who is weak, as soon as you put in a D-ring, it's going to make their life easier to manage. So if you're wanting to control the wrist to allow the fingers and thumb to function, then I mean you're going to go with something simple like this.
So it literally is as simple as that. And if it's holding it support, giving the wrist support so that you can then use your fingers for any function.
And of course, I'm going to cut all of this off. What I really like is to fold over the edges and then just run a quick stitch along here, or stick them together with super glue so that you end up with a nice tab that you can hold on to rather than having it flat down. It's quite tricky for people to pull off against the Velcro. And those are just your very
Yep.
basic wrist braces.
Yep. Okay, so I'm going to do something slightly more complicated. So this is the Sabo Blove, and I find it best to use with people with mild to medium tone. It's really light. Okay, so best way to put it on is probably in this direction. Okay, so start with the fingers. So I'm going to slide the fingers in. Now, depending on how high the tone is, depending on how easy it is, but with a little bit of a push and a shove, it's quite easy. And then we get our thumb in. Really important, we've got the blue edge going down the edge of the thumb there. Around here. So
This is a completely new experience for me.
okay.
You're not going to turn me into a neuro
Okay.
no matter what you
Well,
try.
I've tried. So then we've got our straps. One that goes across here and one that goes across here.
They're very sophisticated straps. So they hook onto small tabs here.
Yeah. So we've got a little.
Is this intended to be put on by the patient themselves? Or
No.
This is going to need, because this looks very fiddly.
Yeah, no, I have found patients that either they work with a therapist or they work with a partner that they do need. It is difficult to put on your own. It's not impossible, but it is difficult. Okay, so we've got it on, and then what I'm going to do is I'm going to put the thumb strap on. Now the thumb strap is really, really useful actually. And for me, I find it probably the most useful part of this. And we're wrapping around the thumb, okay, to bring the thumb into abduction. And then we're going to put the strap on here. Okay, so we've got a really nice positioned hand. So what we've got now is we've got the elastic bands. Now, just for time, I've already put the bands on. So we've got different size bands. They come with different sizes. And you choose the different sizes depending on the tone that you've got. Okay, so I've put I think the smallest band at the top, and then the middle I've put B, and then I'm going to put C onto here. So I'm going to hook onto the bands. Oops, sorry. Okay, so
I did it that way.
yeah, so that would definitely make life easier.
Make it easier for you and people can
Okay,
see.
so as you can see, as I'm putting the bands, I'm putting Nicola's fingers straight. Now, you can use this in conjunction with your functional stimulation as well, your FES as well. I've also used it with other devices. So those are our bands, and then we've got the fun one here. I'm going to ask you to come this way around. Sorry. And this comes in a triangle. Okay, so we come into a triangle formation like that. Okay, so the idea being, so what we've got is if we've got high tone, and it pulls the hand out, and then we're working towards. Okay, so what I want you to do is you're going to work, and you're going to try and grasp the ball. Okay, and bring the thumbs. Good. Okay, and release. So what we often find is that when somebody grasps, the tone is increased and it holds onto the ball, but with a little bit of release, the bands kick in and they help to the release.
As soon as I let the muscle tension go, I can feel it pulling me away.
And it just comes with different. You've got your ball, and then you've got your finer, so that you're working on your pinch grips.
Okay, I like the fact that it's got these bubbles on the front here. So even though it's taking away the sensory aspect, then I am still able to hold on to something.
Yes.
Although I'm not getting that sensory input.
No, you're not getting the sensory feedback from actually holding it. But what it is allowing you to do, and as I say, I do find that this thumb strap, you don't have to use it with a thumb strap, but I found that this thumb strap really helped to be able to grasp and release. And as I say, it's really good for people with mild to moderate tone. That really is, once they've got hold of something, it's just that release, and the bands just kick in and it helps the release.
And again, does this come in different sizes?
Yes, it does. It comes in small, medium and large, I believe.
Okay, because I've got quite a small hand, but but I can see that the positioning over the wrist is about right for me.
Yeah. I think this is a small.
Okay, and the nice thing here I can see as well is you've got a lot of choice with
Yes.
your band
Yeah.
positioning, because you've got 4 different hooks that it can go into.
So we've got our different sizes. So as I say, I've got that on the smallest here, and what I have done in the past is reduce the, you know, you might find that the tone in the little finger isn't so bad. So, and I've actually got it where I've taken these bands off because the majority of tone is in the index and the middle finger. And that's really restricting. So I've taken those bands off and I've just worked with that. But the bands do allow to give you a little bit of flexibility, as well as the different levels that you can put them on, and the thumb as well.
Yeah, the thumb is well designed with the triangle.
Yes,
I like
yes, yeah. I really like the thumb. I really like this movement that it enables, facilitates there.
Yeah, so you can actually manipulate. Okay, interesting. Yeah. Interesting, brilliant. Well, that's a whole new experience for me. So that was a real whistle-stop tour through the off-the-shelf splits that are available to us here in the UK, and a big shout out to the lovely OT who suggested this as a topic. You know who you are, and we are very much with you, and thank you for suggesting this as a webinar topic. I'm just going to turn to Rachel and ask, do we have any questions?
Yeah.
We do. So what I'm going to do is Rachel will just tell me some of the questions that will come in, and then I'll repeat them so that they can be heard, and then between us we'll try and answer.
Yeah. Well, I'll start off with a nice easy one. We've had lots of questions just for confirmation of the name of the resting splint. So I was
Yes.
wondering if we could just go back through,
That's a very good
confirm the names,
Yes, we can.
including the Sabo. We've had a question on that as well.
Okay, so right. Okay, this is, we've got a little cheat sheet here so that we can remember the names, because it's such a good question. This is the Roan Economic QuickBom, quick, unfortunately, spelled with a K, functional resting splint. That's the black one.
Okay, so again, the second one, again, QuickBom with a K, progressive hand splint. The next one was the Roan Progressive Palm Protector Splint.
And we can probably put, if you want to put those in, so we can actually show those.
Yep.
That's the one that we adapted and put that through. And then we've got the whole comfy range. So
Yeah.
if I bring the 3 together, we can, oh, they're actually attached to each other. So we've got the longest one here, which is the wrist hand. So that's the one with the wings around the fingers and
The toweling type.
they're all toweling type material. They all come in small, medium, and large. They're the navy blue, nicely padded. The hand wrist one doesn't have a thumb piece. The one that is called the rest hand is
That's
that
this
one.
and that has got the thumb piece and the thumb strap.
And this one is called the hand thumb. With the two, and actually it's left right equal, because
Yes,
it's
you can use
actually
it on either
you
arm.
can use it on either
Yeah.
side, this side or this side, interestingly.
Yeah.
Then the one that I made here, that I adapted, this is the Roan Deluxe Functional Position Hand Splint.
Perforated.
And that's the one out of Polyform.
Yeah.
This one, which is the easy form one, preformed.
Resting pan knit splint
And this one,
is the anti-spasticity form splint. Okay.
there we go. And then, I don't know if we want to do the
Yes,
palm
there was some
protectors
palm
as well.
protectors.
Yeah.
There we go.
Okay, so you've got 2 and 2 of these.
Yeah. So one is the palm, called the palm protector.
Yeah, so these are your simple palm protectors. So we've got the palm protector, the simple one, and then the palm protector with the finger spacers.
Yeah.
And then we've got the palm shields, which are the beige ones. They're much more floppy. So you've got the one with the finger, well, they've both got finger separators. They're identical apart from the one with the gel and without the gel. So this is the soft foam, and this is just the shield. And then finally, this
interesting one. It's called the carve it, as in carve like a carving knife. And then you've got the Sabo Blove.
Yeah.
There we go.
Lovely. We've had a couple more questions come in off the back, asking, is this webinar going to be available to watch back, and where can they find a list of all of the products that have been shown today?
Okay, brilliant. So all the webinars that I do, I tend to do one every couple of months. They all eventually go on to the Performance Health Academy. But anyone who's signed up for today, even if you're not live, you'll be sent a link and you'll be able to see it back. Anyone who has come live will also get sent a CPD certificate as well. So you can do a bit of reflective work on everything that you've seen. And then actually the office, because they knew that we were doing this webinar, have produced a single sheet with all of the codes, all of these splints listed, and all of the prices. So all you need to do is ring customer services at Performance Health, and they will send you the list with every single one of these products on it. Looks like a jumble sale now, doesn't it? We're both two very neat people.
Yeah,
It's all really a little bit overwhelming, with it. But you can easily just ask for that list, and it will give you the codes and it will give you the prices.
We've probably got time for one more. So recognising that it's case by case and thumb positions vary, but is there a standard position that the thumb should be in when making a resting hand splint?
I don't know if we're going to agree, but
I
mean, certainly, you know, the position of safe immobilization of a thumb, which is biomechanically based, so it's all about the position and the length of the collateral ligament around the joints, is in abduction. So you want to try and get a nice C position, so not extension up here, but abduction. And again, that is the functional position. So that is a position, if a thumb is going to get a little bit stiff, although this is the stiffness prevention position, then abduction is where you're aiming. So obviously high tone thumbs are very often abducted.
Yeah, and I would say that thumbs are a really big problem actually with tone. And yes, I do agree with Nicola that ultimately this functional resting splint, because that is really for function, because that's the way we can use our hands. However, thumbs are often a problem, and people do find a lot of pain when they come into abduction. So you can find it a little bit more, and as I say, so that would be this position, whereas the splint that we tried, the comfy splint that we tried before, that actually has got the thumb in more extension and less abduction. And yes, I do prefer to try and get abduction, but often, yes, it is better to get this comfortable flexion position. And sometimes you can't even get it into that position, it has to come straight out. So
I think ultimately the position you want to avoid is adduction.
Yes.
So then you've got to go with tone and comfort and hygiene. So you're edging towards out of adduction into abduction and a little bit of extension.
The other thing that I would say is it's very, very easy when we as therapists handle somebody's hand with high tone, and we do our passive stretches and we get them into a really lovely position, and yes, we can get them into a splint. It has to be a realistic position that a carer can get the patient's hand into. And if it takes a lot of work to get the position the hand into this position, then don't give them a splint that goes into that. Give it something that's realistic and can be positioned comfortably.
Yeah, I would completely agree. Is there another quick one?
No, the rest are a little bit more detailed.
Okay, so what we usually do is after the webinars, the questions that we haven't managed to address today will be sent to us. Miriam and I'll have a look at them over the next couple of weeks, and we'll know who sent them, and we'll just email you back individually. You can always send questions in. If you send a question for either myself or Miriam via Performance Health, or in fact via Miriam May OT, why not? Directly to us, because we work together. So just by all means contact us, and we'll try and do our best to help you uncover them. So I hope this has been a little bit helpful. I know that when I've had patients, or we've shared patients that have needed splinting, one of my frustrations has always been that you can't afford to buy a demo splint of all of these different ones, and you sort of want to have a touch and a feel of it. So that's what we were trying to do, give a touch and a feel of the splints for you so that you can have a visual guide. So when you've got these patients, you clinically reasoned, you think you need it,
See what they look like,
See what they
how
look
they
like.
how they fit.
Absolutely. So just before we finish, thank you so much for joining us. Thank you, Miriam, so much.
It's been lots of fun having a play. I've really enjoyed it.
Yeah. And have a great afternoon, everybody.